Nursing Council. Today it comprises Martin Luther Care Center, home to 128 residents, and Meadowwoods, our assisted living and memory care community, which serves 106, in addition to 2 adult day centers. 85% of the individuals we serve here on this campus receive Medicaid. And we are here because of the significant changes to Medicaid being discussed that would dramatically impact the access to services and the quality of life of those we serve. But not just here, all across the country. At Ebenezer alone, for example, we have over 1,000 individuals every day across our skilled nursing communities and housing communities that rely on medical assistance funding to receive their services. It is vital for all of us, lawmakers, providers, families, and community members, to stay informed and be engaged as we navigate these potential reforms. So with that, I am honored to introduce someone who works diligently on these issues every day. Please join me in welcoming Senator Amy Klobuchar.
Okay. I've got to have a doctor at my side, Congresswoman Morrison, who's actually represents this district as well. And I want to thank Brett and all of you, as well as Bob Christensen, who's a resident that we're going to hear from. Thank you for spending the time to talk about this incredibly, incredibly important thing when it comes to long-term care and health care for the people of Minnesota. And Martin Luther Campus here, I want to thank you for hosting us, all the people that work here that you all know so well. And this place has a long history of providing excellent care and housing for seniors. People rely on the Martin Luther Campus out here in Bloomington. So today we're going to talk about something that makes all the difference, and that is Medicaid. So I want to give you some sense of this. More than half of nursing home residents in Minnesota rely on Medicaid. And I think sometimes people think, oh, that's just for something in Minneapolis, or that's just something in a small town, although 20% of rural Minnesotans rely on Medicaid for all their health care, right? It is, in fact, everywhere. I know this very well myself because my dad got late onset Alzheimer's, and he was in a home like this, and I knew the day that his savings were going to run out, and it was about, I knew the exact month, and then he was going to go on Medicaid. And it was always in my mind because we were actually going to have to move where he was staying because they didn't keep Medicaid. And he ended up dying, and we miss him very much, but he died a year before that. But that affects so many families in Minnesota and across our country. So Kelly and I are here because the Republicans in Congress are right now moving forward with a budget that threatens health care for 72 million Americans who get their health care, 72 million through Medicaid. And in Minnesota, that's more than 1 million seniors, families and kids, veterans, and people with disabilities. Those are the numbers. But I think we know it's not just about numbers. It's about the person sitting next to you right here. It's about your family members. It's about your own families and what would happen for those of you who are residents, what would happen if you lose part of that Medicaid and what would happen to them. It affects really everyone in Minnesota. Over the past weeks, I have heard from thousands of people across our state who are worried about how these cuts would affect their health and the health of their loved ones. I think about people like Bob, who's here with us today. We'll hear from him soon. I think about a constituent from Invergrove Heights who told me that Medicaid helps her to afford the cost of her father's memory care. She said, "I'm not sure what we will do if we cannot receive this benefit." And I think about what I heard from another constituent, a working mom of 2, whose parents rely on Medicaid. That's what I mean about the health care, for their health care. She told me she doesn't think it's fair to shift the cost of care to families like hers to pay for tax cuts to the wealthy. That's the issue. In this same budget, there's over $2 trillion of tax cuts that go to the wealthy, people making over $400,000 a year, or big corporations. And our point is that think about that, and then think about all of you and the people in our state, half of the people in nursing homes that rely on Medicaid. So this constituent wrote, we need to draw the line, we need to draw the line and say this is enough. I couldn't agree more. The budget that they have proposed would spend more than $2 trillion, as I said, on tax breaks and benefits for the wealthiest and make regular Americans pay the price. Instead of cutting costs, they're trying to cut Medicaid, which provides health care for 7.2 million seniors, almost 40 million children, nearly and nationally 2/3 of nursing home residents, and millions of veterans and people with rare diseases. They're jeopardizing services provided at rural hospitals and community clinics across our state. As I know that many of our leaders in healthcare know, as Brett knows, these rural hospitals especially, these small hospitals in small towns really rely on this kind of funding. They are jeopardizing services for everyone, and that is why we are standing up, Representative Morrison and I, in Washington, along with Senator Smith and several others, to say enough is enough. I fought to end Big Pharma's sweetheart deal. I think you know that, in the last Congress, and we finally are getting prescription drug negotiations, right? We got the $35 cap on insulin per month for our seniors, and we're also getting, starting next year, we have the $2,000 cap on out-of-pocket expenses, but we're also getting negotiation for key drugs like Januvia and Eliquis and Xarelto and Jardiance, with more to come with the negotiations that this administration should be taking on for drugs like Ozempic and other weight loss drugs. So those savings are set to go now for the first 10 drugs. And what really concerns me, in addition to these Medicaid cuts, is they also have not been supportive of keeping these negotiations going in terms of funding. We're really worried they're going to claw back some of the people that we need, and they've already fired a bunch of people, right? And that they're going to fire the people, and they have started to do this, that would be doing these negotiations, because they're very complex negotiations, because you're taking on the biggest companies practically the world has ever known, except for the tech companies, the pharmaceutical companies. And so you really have to have people there to do it. So I just came in from Washington, and there was a guy on the flight attendant on the plane told me he was so worried about losing the park rangers. And I'm like, what do you mean? You can be a volunteer park ranger now. This is just an unbelievable thing they're doing, but today we are focused on the Medicaid program and the costs, what it's going to cost all of you if their budget goes through. And Kelly and I are standing up against what they're doing, and we're standing up for you and Medicaid and nursing homes in Minnesota. So with that, I'm going to turn it over to Kelly.
Thank you, Senator Klobuchar. How cool that we have Senator Klobuchar here today, right? First, I want to thank Brett for having us here today to highlight such a critical issue. Thank you so much. Thanks to Bob, also for joining us and being willing to share your story and help explain the real impacts of these proposals coming out of Washington. Good afternoon, everyone. I'm Kelly Morrison, the new Congresswoman for Minnesota's 3rd Congressional District, which includes where we are here today in Bloomington. It's a huge honor for me to be here with you today, and it's an honor to be your representative in Congress. While I'm here as my role in my role as a member of the U.S. House of Representatives, I'm also coming here as someone who has spent my career as a doctor. For more than 20 years, I've had the honor of caring for Minnesotans. And if I could make one thing exceptionally clear to my Republican colleagues in Congress, it would be this. Healthcare coverage is not just a throwaway line item that you can scratch out in a budget. It is the difference between being able to receive the life-saving care you need or not. It's really hard to overstate the importance of Medicaid, right? Medicaid is the single largest source of health care coverage in the United States. Medicaid is the primary source of long-term care in the United States. Medicaid, as Senator Klobuchar said, covers more than half of nursing home residents here in Minnesota. In fact, 85% of all residents here at this campus are covered by Medicaid. It provides critical access to cover nursing facility care, home care, and other long-term service care and supports. And yet, Congressional Republicans' budget is proposing to gut this program. They're proposing massive cuts to this essential health care program, and they're doing it to pay for massive tax cuts for billionaires and the wealthiest and giant corporations. They're prioritizing tax cuts for the very top 1% and paying for it at the expense of the 1.2 million Minnesotans who get their health care coverage through Medicaid. We're here today to say this is not right. This is not what we stand for. This is not how we respect and care for our seniors. We must do everything we can to support our seniors, to support their caregivers, and expand access to health care, not take it away. But that's exactly what's under threat right now. Just earlier this week in Washington, on Tuesday night, congressional Republicans brought their budget proposal to the floor of the House. They actually canceled the vote and unexpectedly sent us home because they didn't have the support to pass the budget. That's because there were enough Republicans in the House who know how much this budget will hurt their constituents. It'll be way too harmful to them. They knew they would not be able to vote for something that would gut funding for nursing homes, home care, long-term care, health coverage, and food assistance. But ultimately and unfortunately, Donald Trump made some calls and they caved into that pressure. This is what we need to be extremely clear-eyed about. This is what we cannot afford to lose sight of. The reason they are so intent on cutting the budget is so that they can cut taxes for the wealthiest among us. And they're trying to do it on the backs of the American people. This should not and really is not a partisan issue. Just last week, actually, more than a dozen Republican state legislators right here in Minnesota wrote to the Republican members of the congressional delegation and President Trump expressing their deep concern about the proposed budget and imploring them to not move forward with these devastating cuts to services and care for our seniors because they understand that these cuts would be harmful to their constituents. And I want you to know that we are not alone in these concerns. I've heard from so many Minnesotans who are deeply concerned about what these cuts will mean for their life and their loved ones. And in particular, I visited and heard from our hospitals and the doctors and nurses and staff who work in them. Gillette's, Children's Hospital, North Memorial, HCMC, all are deeply concerned about what this budget would mean for the care they provide to Minnesotans. Some are saying explicitly that they would have to shut their doors, which would be devastating for the surrounding communities and our entire state. From new moms and babies, Medicaid covers 40% of all births in the United States. To children, Medicaid covers 650,000 kids here in Minnesota alone. And to our seniors, Medicaid covers more than half of nursing home residents. Medicaid is an essential program. In just a moment, I'll be turning it over to Bob Christensen, a resident here at Martin Luther campus. Bob and everyone here at Ebenezer Senior Living Facilities is who the budget should be working for. The budget should be making life, housing, healthcare, and support services more affordable to seniors here at Ebenezer and all across the state. The budget should be making access to care easier for seniors here at Ebenezer and also across the state. It should be supporting the caregivers who work tirelessly to support seniors here at Ebenezer. That is what the budget should be doing. That is what Minnesotans deserve. And every day, that is what Senator Klobuchar and I will be fighting for in Congress. But we really can't do it without all of you. Speaking up and sharing stories are powerful tools in this fight against a dangerous budget. It's what creates the pressure that forces those few Republicans to stand with the American people instead of the world's richest man, you may have heard of him, Elon Musk, and the top 1%. So with that, I'm going to turn it over to Bob. Bob is a lifelong Minnesotan, a graduate of Central High School in St. Paul and the University of Minnesota, and a father of 3, and he's also served our country in the U.S. Marine Corps Reserve. Bob, thank you for your service and for speaking out and sharing your story here today. We'll stand on either side of you.
Yeah,
We'll stand on either side
we're
of
here.
you.
So many women. Yes, as you heard, my name is Bob Christensen. And yes, I was born in St. Paul, Minnesota, October 3rd, 1939. That's only 58 years ago. Oh, wait, I'm dyslexic. 85 years ago. And that was with my twin brother. We were born into a happy, loving, caring family. I had 9 siblings, plus my parents. All live in my mind and in my soul. I graduated St. Paul Central in 1957. I was placed on active duty by the Marine Corps a few weeks later at the age of 17. I served our country happily for 7.5 years. I married in 1959 and have 3 loving, caring children. And that's a little bit about me. The things that we want to get into, the benefits of Medicaid have allowed me to continue a productive life worth living through improved health, staying above ground. I continue to enjoy my family, my extended family, my friends, my artwork, my music. Without Medicaid and good care providers, I would not be here today, and a continued life plan through 2032 and beyond where I'm at today. I think with the drastic changes in Medicaid included in the new budget, that unlike Robin Hood, they take from the poor and give to the rich. I would be negatively impacted in the following manner. My life would be shortened probably by 5 years, thus depriving me of the life well lived that I enjoy and all good things I mentioned previously, especially the joy of family. I am fighting this with all the effort I can muster. I have joined Indivisible. I am calling my representatives on both sides of the aisle. I join protests when possible, and I vote. I invite you all to join me and to join our representatives in this fight. Thank you for sharing time with me.
Very good. All right. So if you have any questions, I guess Bob will answer them all.
Oh, yeah.
So anyway, let us know. Yeah. Oh, yeah. If you have any questions of Bob, any of the reporters, anyone? So we can let them sit down if you don't. Okay. Any? I think you're okay. You were so good.
Thank you.
Yeah.
You make me proud.
Okay. Oh, thanks, Bob. Okay. Any questions of Kelly and me on this topic? Are we good? Okay. Well, thank you. We have one from. Yeah. Okay.
Bob kind of mentioned what he's doing and invited us to join him. What would you suggest would be
Sure.
his approach to being either a worker
Okay.
or someone who has a loved one, or
Sure.
just being concerned about this for those people that you told us about?
Sure. So we'll just take this one from the audience here, and I'll say this: we need you to write in. Emails are really helpful because then you can more tell your story. Phone calls are great, right? But emails are where we have an actual written account of the story, and we don't have to use your name. You can write at the top, tell this story, but I don't want my name there. That's fine. And then when we give speeches, when I give speeches at the Senate floor, one time about 3 weeks ago, I read, I think, 50 parts of letters from Minnesotans. And then it becomes part of the Senate record, and it's actually, it's an interesting way to do things, because then you have actual examples of what happened. And Kelly and I can tell the story of being here, and that all of you were here on this Friday afternoon to show how strongly you feel about this. Or we're going to have Bob's story, 9 brothers and sisters, works his whole life, and here he is, and he just wants to live with dignity, right, for his last few years. Those are the kind of stories that mattered. And then, of course, calling people. I think it's really interesting that in Minnesota we had some Republicans stand up and write a letter in the legislature and wrote the Republicans, because they know where Kelly and I are, that we are opposed to these Medicaid cuts, but wrote them and said don't do this, because they knew the financing of long-term care in Minnesota. They knew that half of it is Medicaid. They know that it's not just in urban areas, it's big time in the suburbs and in the rural areas as well. So I don't know if you have any other ideas, Kelly.
Yeah, I would reiterate, sharing as specific as you can be with your story is really powerful. And I think that, we almost stopped the passage of this budget in the House because of pressure, from grassroots pressure on some Republican districts. I do think that President Trump was able to convince them in the end, but they were really dragging their heels because they know these cuts will hurt their constituents. So that grassroots effort really makes a difference, and I do think the power of stories is very compelling. And I can tell you that I've had thousands and thousands of Minnesotans reach out to my office, phone calls, emails, talking about this very subject. And when I can share that, say, look, I've had literally thousands of people contact me because they're so concerned, that's very compelling. It makes a difference. You're not shouting into a void.
Right. Okay. And this is, I don't want you to think this is over by any means, because the House is still considering all the details of it, and then it has to go to the really fun workplace, the United States Senate, where they have all kinds of rules, and we have all kinds of things that are going to go on there, and big debates in the Senate as well. So it's not like this is like, get this done today. You are going to have weeks to be able to contact people. Okay? All right. Thank you very much, everyone. Thank you.